Is aspirin bad for you? That's what the people are saying right now. They're saying that maybe you shouldn't have an aspirin. They used to say you should have a baby aspirin if you're older, that you should have a baby aspirin to prevent stroke and heart disease. Now they're saying, oh, it may not be good for you. It may be bad for you. Stop taking aspirin. What's the truth? My name's Matt Cook, and I am a health researcher. Nobody owns me. We have about 20 people on my team. We help find remedies and studies that have been buried, little known. We give you a different point of view. So what's the idea about aspirin? Is it really good for you? I've doing a live web workshop on aspirin. I'm going to be talking about what I take aspirin for, how I believe it helps cancer, how it helps to fix problems in your jaw and your teeth and your bones, heart disease, and even other stuff such as preventing cataracts. I think aspirin is a tremendous tool. The thing is, Big Pharma hates aspirin. They're always dissing aspirin because aspirin is ultra, ultra cheap. You can get an aspirin tablet, you can get treatment for aspirin for a penny, whereas these drugs that they're prescribing sometimes cost $3, 4, 5, 10,000, $30,000 a month. So they hate aspirin because of what it can do. For example, aspirin can help heal dental problems. Now, before you go ahead and take aspirin, always talk to your doctor about it first because some people can't tolerate aspirin. Some people have medications they're taking that interact badly with aspirin. Never take something as powerful as aspirin without checking with your doctor if you're under any kind of medical treatment or have any doubts whatsoever. Aspirin, ibuprofen. Some people have asked me, Matt, I'm taking aspirin. I also have bad pain. Aspirin doesn't really help the pain that much. I want to take ibuprofen also. Can I do it? Yes, you can. You can take both ibuprofen and aspirin. The aspirin and the ibuprofen both work a little bit differently. They're both non-steroidal anti-inflammatory drugs, but aspirin has more benefits to the body. Ibuprofen can cause some harm. I try to avoid ibuprofen as much as possible, but if you do need to take them both, it's perfectly fine. Now, what about cancer? Aspirin use can reduce the chances of dying from colorectal cancer as much as 70 or 80%. There is nothing as powerful as aspirin in preventing colorectal cancer on a routine basis. Again, don't take this as, oh, I'm taking aspirin, I don't need to get myself checked out. But the numbers for aspirin are staggering in favor of aspirin for preventing colorectal cancer, and people taking it after diagnosis had a much, much lower mortality rate as well. In this study, less than half the mortality rate. That's pretty amazing. Aspirin also can help for many other types of cancer as well. Aspirin can help you with your lenses of your eyes to help prevent cataract. Aspirin can help you prevent stroke and a heart attack. And a lot of times people are saying, it didn't work for me. I got a heart attack anyway. Of course you could, but if you're overweight, you need to take more aspirin than just a baby aspirin. In fact, some of the studies have shown that there's a effect where if you are overweight, you may need to take as much as one tablet or 1.5 tablets, about 300 to 500 milligrams per day because of your body weight. So you may need a lot more aspirin. If it hasn't worked, maybe you're just not taking enough. One of the things that everyone always says about aspirin is that it causes bleeding. However, it doesn't cause bleeding. What aspirin does is it depletes your body of vitamin K, which is a clotting hormone or a clotting compound, rather, a vitamin. Vitamin K depletion can then cause bleeding, bruising, gut bleeding inside of your gut, your digestive tract, nosebleeds, bleeding out of all ends of us, okay? But if you just take vitamin K2, MK4, it's fine because that replenishes the vitamin K in your body and then you don't have the bleeding. It's really just a matter of not taking the vitamin K, this cofactor that people are, that's the reason. And just look at what you can get. You can get 1,000 aspirin tablets for $13 from Walmart. You can get a pound of aspirin for $5.50. Look at how cheap that is. It's so cheap. They hate us. They hate aspirin. They hate how it prevents cataracts, how it heals dental problems, how it can prevent heart attack, how it can be used for a whole range of things, including cancer. Remember, if you're heavy, you may need to take more aspirin. In this study, they had 22,000 men who were physicians. They're a good test group to work with. And they gave some of them 325 milligrams of aspirin every day, which is a full adult aspirin tablet, versus some of them had a placebo, okay? And the people taking aspirin, 44% lower incidence of fatal or non-fatal heart attack. Much lower, okay? Why not take aspirin? I think you should strongly consider it. And if you'd like to, head over to dailymedicaldiscoveries.com, get on my list where you'll get my newsletter every day, and you can then participate in my live masterclass on aspirin. Matt Cook here. Thank you so much. God bless. Talk to you soon.